Good afternoon, viewers. Good, depending on where you are reaching this or the time you're getting access to this video. I'm Dr. Idoko Paul. I just want to give us a little, addendum, or what you call a little enticer concerning the medical field. You see, as a medical scientist, it is very, very important as a researcher to be involved in all manner of diversified field. Especially research in the medical field is very, very encompassing, because most of the times what you do, there's a difference between you practicing as a medical personnel, or as a nursing student, or as a nurse, or as a physician. But it's another thing to be able to juxtapose this kind of practice with your inherent abilities for research. There's a difference between a practitioner and a researcher. What makes a practitioner a good researcher is the ability to have skills that will make you different from your contemporaries, and these skills is what is encapsulated in what we call biomedical data analysis. You see, once a person has the skills in biomedical data analysis, you see that this person has ease to not only to be limited as a practitioner, but also to be a very good researcher. So the question is, so you can perhaps you watching this video, you may say, oh, I'm an anatomy student, I'm a physiology student, I'm a student of nursing, I'm a student of medicine. So how does this? That's not true. When you are able to develop your skills, you see that even when you go to the clinic, you get chunks of data. When you go to the hospital, you get chunk of data. And then when you go to the field as a biomedical scientist, and also as those also in biological anthropology, you see that you come with chunks of data. Now the question is, how can this data be presented and easily understood? How can this data be represented and be easily appreciated? That is what is called data analysis. So you see that data analysis gives you an advantage, an edge as a scientist. So you see that you'll be able to appreciate, you'll be able to deliver those data in a very, very, very simple manner. You see, I see many students around, both in the medical field, in the colleges of medicine, the colleges of health sciences. They give less attention to developing skills. It's not all about you being able to get a certificate as a nursing student, get a certificate as a medical student, get a certificate as an anatomist or a physiologist or a medical lab scientist, but it's all about you being able to juxtapose and also impose yourself in the system. So when you have those skills, you see that most of it's not all about getting those ideas, but you're able to represent them in a way that your colleagues or other people will know that, of course, this work you did made sense. So now, as the world is, we are in the world of genomics, we are in the world of biomedical anthropology, we are in the world of biomedical sciences. So we need to come to the point where we develop skills, and those skills should make us to also flow with the trend. One of the major trends is that the world is full of data. Large data, big data, all manner of bogus data. And then the question is, how can this data be presented in a way in which it can be appreciated? Whether it is a public health data, whether it's a nursing data, whether it's a clinical data, whether it's a data that a medical data, or it is a biomedical data, it needs to be presented in a way where it can be appreciated. And then one of the major ways to present those data is what is called biomedical data analysis and biomedical analytics. So your ability to analyze those data is what is very, very important. So most of those skills need to be developed, and it is not too bad at this stage of your career to begin to develop those skills. And I know that once you do these things, you see that your career will go to the zenith. Thank you.